Welcome, everyone. Thank you for joining today's SimCapture product showcase. My name is Rebecca Cherry, and I'm part of the marketing team here at Laerdal. Just a little housekeeping before we get started. All attendees will be muted. If you have any questions during this session, please share them via the Q&A feature that can be found at the bottom of your screen. We'll be monitoring them throughout the webinar, and we will have time for questions at the end. Today's recording will be emailed to you after the session is over to watch on demand. Now, I would like to introduce the host, Helen Wudam.
Thanks, Rebecca. Hello and good afternoon, everyone. Welcome to today's product showcase featuring SimCapture Cloud, specifically showcasing the enterprise-level features. As Rebecca mentioned, my name is Helen Woldab, and I'm the product marketing manager for SimCapture, and I'm glad you're joining us today. The purpose of this session is to provide you with more insight into SimCapture's learning management solution for simulation education. SimCapture Enterprise allows admins to effectively manage, record, and assess simulation training anywhere at any time, with access to valuable data insights while generating reports and statistics on performance and trends to track usage, KPIs, and learning outcomes. With easy-to-read reports, SimCapture solves evaluation and assessment problems and improves overall student learning competency. During today's session, you'll have the opportunity to view an in-depth overview of SimCapture Cloud Enterprise, highlighting how evaluations, assessments, and the collection of event-based data can help deliver high-quality training and education. You'll learn step-by-step instructions on how to create a basic student evaluation using the widely known Vernon-Russell nursing scenario. You'll also learn how to eliminate manual data input and analysis by incorporating custom-built evaluation tools. And you'll learn how simulation and debriefing management can enhance your overall nursing program. Depending on your learning objectives, we can help you implement the tools you need to succeed. Following this presentation, we will have 15 minutes for Q&A, and we'll also answer questions that were submitted during the registration process. In addition, we'll answer questions about specific features throughout the presentation, and we encourage you to type questions in the Q&A box at the bottom of your screen to help make this a meaningful and engaging session. In the event we cannot answer your question during the session, we will follow up with you after the session's over. So next, I'd like to introduce you to our presenters and product specialists, Tyler Richmond and Paul Foxlater. Tyler is a SimCapture education specialist based out of Arkansas, and Paul is burning the midnight oil in Perth, Australia. He is a global education specialist for SimCapture. So without further ado, I'll turn it over to Tyler and Paul to walk you through SimCapture Enterprise.
Thanks, Helen. As Helen said, assessment and evaluation is often resource intensive in the collection and collation of data. SimCapture Enterprise can solve these issues by providing digital evaluations and event annotations for assessment of learners that passively collects the data and collates it into easy-to-read reports. This makes performing learning needs analysis simple and effective at the individual and course level. Today, we're going to have a look at the Vernon-Russell scenario. Vernon-Russell is a 55-year-old male who was presented to hospital with left-sided hemiplegia and after having a mild transient ischemic attack. The student in the scenario would be expected to perform a neurological assessment. And when he is given his medications, because Vernon is charted nil by mouth, except for his medications, he will start to cough and aspirate, and the student will have to rationalize that his situation has changed and he's deteriorating and will need to respond appropriately. I'll now hand you over to Tyler, who will go on with the SimCapture Enterprise demonstration. Thanks, Tyler.
Thank you, Helen and Paul. Like Paul said, we're going to walk through a workflow for this Vernon-Russell case. Before we actually start looking at the details of the course of Vernon-Russell, let's click into the system setup area and talk about some of the features that can help your organization collect data. We can add inventory. Inventory might be ultrasound, defibrillators, really any big ticket item you have at your institution that you want to reserve and then pull data on to find usage with. You can also create different organizations within SimCapture. This can be for data collection, as well as separating those permissions for our users as well. Building out evaluations, those questions can be associated with question categories, and then we can find data off of those question categories. The systems allows for you to customize what you want your administrators to have permissions to be able to do within the systems. You can do this at a default level or a global view, as well as at the course level and the session level itself. Scrolling down, one area I always like to focus on as well is the annotation library. These are bookmarks and events we want to reference back to during our recording sessions, and then we can also populate reports from the annotations that were clicked through the recording sessions. I'm going to go ahead and click into the course tab. Courses can be created very similar to what you're actually doing in your lab. Think about MedSurg 1, MedSurg 2, OB, critical care, those type of courses. And then scenarios and evaluations can be created inside the course for your learners to fill out and do in the lab. I'm going to click down into our data example for medical nursing. We can see that we've added learning objectives for this course. Scrolling past the learning objectives, we can associate this course with an organization. That way, certain users can only see this course, as well as we can pull data on how much this course is being utilized. Scrolling past this, we can see that we have a summary for this course. This course, it will contribute to program learning outcomes for the ANA Standard of Professional Performance. Scrolling past the summary, we can see that we have an area that we can have curriculum, agenda, and results. We also can add attachments to this course. This can be available for our students as well as for our faculty members. We're able to associate staff members as contributors and grant them certain permissions for this one course. As we can see, we have Paul admin, and then we have a demo admin acting as our faculty members and our instructors that need a higher level of permission to do things inside this course. Then we're also able to add participants into this course as well. Let me back. We can see that we have a curriculum for this course. We can see we have a Vernon Russell scenario as well as a pneumonia scenario that is available. Let's go ahead and click into the scenario for the Vernon Russell that Paul talked about earlier. We can see that we can have a place for an overview as well as for our learning objectives for this scenario. Scrolling past that, now we can add the evaluations that we want to be associated with this scenario. We can see that there is a before scenario that is associated with this. We see that there is a administrative evaluation as well as a after session evaluation and a reflection. The before, we can give permission for our students and our learners to fill this out. We can put a time on it as well. The administrator evaluation will be available for the faculty member, instructor, staff member to fill out during the recording session. Once the scenario is completed in the lab, then the after session evaluation will become available and they'll be able to fill that out. Same way with the reflection. I'm going to click into one of the evaluations. We clicked into the administrator evaluation. So this is one that the faculty member would be able to fill out while the students are performing the simulation. I clicked in to the edit view, so you can see that this evaluation question has answers. It can be associated with a point. And then we can see that this evaluation question is associated with one of the question categories that I showed you earlier in the system setup area. And then we can scroll down again and see that this number 2 question is associated with a different question category. You're able to customize this to whatever your facility needs are. If you're following a QSIN type of evaluation or some type of another standard, you can apply those into your evaluations. You can add media, you can change the format, completely customize this for your facility needs. Clicking back into the scenario, scrolling past, you're able to add those annotations that I spoke about earlier for this. For this scenario, we've added a few annotations as in introducing themselves, washing hands, drug rights, assessments, communication, fall risk, everything appropriate for this Vernon Russell case. You can also add time before and after for setup and takedown. So when you create a reservation in the calendar feature, that it will automatically put that 15 minutes and 30 minutes for that reservation. There's also functionality of a video deletion policy that can be placed as well. Scrolling back up to the course. Scrolling down. We can go to the agenda. In the agenda, we'll click into the month view. You can see that you can see the scheduled events here. You're able to assign evaluation at the course level, as well as releasing scores to our students and releasing the videos to them. Clicking back into this. Paul, do you want to demo the student view? Go ahead and.
Absolutely, Tyler. So as Tyler said, that when we schedule something through the calendar and we have a before session evaluation, it will deploy an evaluation out to the student. So this is what the student will see when they log into their site. You can see that the only thing that they have here is their calendar, which will tell them what they've got. And this particular student, Richard, has been told he's got an evaluation here to do. So I'm just going to click onto the hyperlink here as the student would, and it will open up the evaluation for them. There we go. And you can see here that this one actually has a video. So the student can watch a video here. You can do the video that you need to, that you like. This is about performing neurological assessments, as this is about a neurological case, which is Vernon Russell. So the student here would then go through and they would pick the appropriate one. So when taking a patient history, select that all that would increase the chances of stroke, diabetes, hypertension, smoking. And they would then go through. The other questions are in here are all to do with dysphagia, as that's what Vernon will experience during the session, and how to respond and what they should do. I'll just point out that each one of these questions is aligned to the question category, as Tyler pointed out before. Question categories are broader elements that can define learning objectives and perform the basis of robust reporting in the system. I'm just going to go right ahead and submit this now, and the scores from this will be uploaded to the reports, which we'll show you later. I'll now pass it back to you, Tyler.
Thank you, Paul. Let's go ahead and share my screen again. I have now transitioned into the main page by clicking the top left button here of the SimCapture icon to get us back into the home page. Let's go ahead and talk about running the actual recording session itself. The way that you start a recording session is you pick the area that you're going to start the session from. So we're going to go into our orange pod. As a reminder, I'm here in Arkansas running a recording session in our lab in New York. So that's one of the cool features and nice features about the cloud feature is that you're able to work, view, and run recording sessions off campus, 1,000 miles away if possible. I'm going to go ahead and we can see from our reservation that we have in our calendar view that we're able to start a reservation, start one of the reservations that we have, or we're able to start an ad hoc or on the fly recording session if we need to. Let's go ahead and click into the Orange Pod product showcase demo reservation. We can go ahead and hit the start session. We're able to see multiple feeds up to 4 inputs. We have 2 camera views here as well as the patient monitor for this demo. I'm going to go ahead and mute the room because this is the lab in New York. We can see that we have the patient monitor view as well as 2 other camera views. We're able to take away one camera view or both camera views if you would like before the recording starts. You're able to move the camera around and customize the view with our PTZ cameras. So for our number 2 camera, we can see that we can move it around. From starting the recording from the reservation, we can see that we already have the course that is associated with the data example medical nursing, as well as the scenario, the Vernon Russell case that we've been working through. We're able to change the title. We're able to change the organization if we would like at this particular point. We can change it to the education team. We're able to choose our simulator. One of the nice features about SimCapture is you can input your simulators in there to keep track of them. One of the important part of getting accredited or for grants or justification is keeping track of time and usage of our mannequins. So we can go ahead and select the 3G. We can add our participants to this recording session. This is how we associate our students and our learners to a recording. We've already picked Richard as one of the students, so he's already in there. If there were more participants, as we can see, we have the choice between the course participants out of 23. And then we're going to go ahead and hit the start recording. One of the features of SimCapture that it is not company specific. You are able to add different company, mannequin companies and simulator companies into the SimCapture system. We can see that now we have a wide view of our recording area. To the left bottom, we can see that this is the time as well as the volume control. The red circle in the middle here is the actual time, so we're going on 30 seconds. We're able to add ad hoc or on the fly annotations during our recording sessions. One way of doing that is to hover over and we can see that now the word annotate appeared. As we can type something into here that says checked patient ID. And then I'm going to hit the enter button, and we can see an annotation has been populated. During the recording, we're able to change the layout of this view. We're able to take away camera views and put them back. We're able to change the views from a vertical or picture-in-picture view or flow. Clicking the blue sidebar, this opens us up to the summary. We are able to change details if needed. If something, we started a reservation by accident and we needed to associate it with another scenario, we are able to do that as well. We're able to add contributors, those faculty, those staff members into the recording session and allow them certain permissions for this recording session. We're able to add participants, add viewers to the recording sessions as needed, and then modify their permissions as needed. Clicking along the top bar here, we can see that now we're into the annotations. We can click these annotations as the students are performing these tasks. So we can go ahead and click through a couple. We can say that they introduce themselves, they wash their hands, they checked documentation. We already placed the ad hoc annotation in here for checking the patient's ID. Went ahead and we'll click through a couple more. Assess the LOC, assess facial, and then we'll scroll down and say that they did some therapeutic communication as well with that. Clicking along the sidebar here, we can see that we have an event log. These are all the events from the simulators as well as from SimCapture. They're coming together to create this event log. This event log then can be downloaded into Excel form, put in some type of record if you would like. You can also distinguish and break up between the simulator data that comes over into SimCapture as well as the data from SimCapture itself. So if I have data, we can see that we have no simulator data available, but if there was, it would show up right there. Clicking along the last area for this recording, we can click over to our evaluation. We can do a team evaluation, right? There must be a group of students that are going through this Vernon Russell case that we're doing. Or if I want to evaluate the individual participant, I can click on the individual participant and then it drops down to their name. We can click into Richard's evaluation and I can complete the evaluation. Paul, while I'm completing this, do you want to go ahead and speak on the evaluations for us?
Absolutely. So you can see here that as Tyler's ticking them off, this is being done in a format of observed and not observed or when prompted, but this is totally customizable. And again, each of these questions is aligned to a question category. So shortly we will go through some of the reports and you'll see where that's useful. So this is a really good way to be able to balance quantitative data from annotations and qualitative data as in the evaluations from the assessments.
Thank you, Paul. Clicking through, I'm going to go ahead, hit the submit button, confirm that. And now we can see that we have a completed evaluation for our students. So again, imagine your faculty being logged into a computer. They're watching this through a device, a laptop, maybe a PC somewhere in their office even, because remember, this is cloud-based. It could be right beside you in your control room, and they're filling out this evaluation as the operator is running the simulator and SimCapture. You can have multiple people logged in viewing the same recording as well. I'm going to go ahead and in this recording, Clicking the end button, it does populate a message. Are you sure you want to end this live session for everyone? Because just as I spoke on, you are able to view sessions, maybe in a classroom, a debriefing room, maybe you want to social distance, you can log in to multiple computers and view the same recording. Hitting the confirm button here opens up that room, that recording area once again for us. To find that recording, there's a couple of different ways that we can do. We can go over to the left side of our screen into the quick debrief area, which is going to be the last recording session that we were a part of. We can go into scrolling past my courses that I'm active in. We can go to our activities, right? So the last 4 activities that I was a part of. I can click into the recording session. As we can see, this is the last session that was recorded for around 6 minutes and 26 seconds. As well as I can go into the course itself and find it there. Quickly clicking into the recording, showing that when we're in our debriefing stage with our students, we can click through to the exact point that we want to speak with our students about. I can click down this timeline. When I hover over certain areas, it highlights that area. Situation in the debriefing might be brought up. Tyler, I noticed around the 3-minute mark that you were assessing something. Can you kind of talk me through that assessment that you were working on? What were you looking for with that? Might be something that you utilize in your debriefing. Again, you're able to customize the layout of things going in, going back. You can download videos if you would like, change the people. You can annotate after the fact, right? So if something needs to be annotated because we're just really busy and it just needs to go back and catch up on some work, we can absolutely do that. We can make some modifications on the event log. As we noticed that I grouped some things together right here, but if I wanted to spread that out, I can absolutely spread that out, changing the time. So this is really important if we want to click through things, but we want to focus on time. Then clicking back, now we can see that the evaluation that was completed during the actual recording time. Clicking into the system reports, what reports are available for the facility itself? We can pull reports on number of sessions, learner contact hours, number of recorded hours, as well as session annotations, as well as the function of center sign-in. Clicking into the number of sessions, we can see that we can filter this out by courses, participants, organizations. How many sessions, how many hours are my different organizations utilizing SimCapture? This might be a really cool tool and great tool to utilize to distinguish between cohorts. Maybe I want to focus on how many hours my 2020 cohort did versus my 2021 cohort and so forth. How many hours are my simulators being utilized? Those are the types of reports that can be populated. When it comes to annotations, you can see that we can filter this out by course as well. I'm going to pull up a graph that was populated off of this Vernon Russell assessment. You can see neurological assessment of the stroke patient. This is the Vernon Russell one. We ran it 80 times. In those 80 times, we had those annotations that were available on the right side of our screen. We can see that we focused really well on introducing themselves, as well as hand washing and therapeutic communication. But we lacked in some areas of our assessment. So this is a tool besides the evaluations that we can utilize, bring back to our faculty members and say, hey, we're finding some trends that our students are doing or not doing in the simulation lab that we need to refocus on with our students. And deselect that as well. You can see that the annotations has time as well. So it's time is it's important to you, right? So if you're wanting to know when medication was distributed, when a intubation started, when it ended, those type of things, we can also pull that type of data. I'm going to turn it over to Paul to speak on the evaluations and the reports that can be available at the course level with our students now.
Absolutely. Thanks, Tyler. So I'm in the course page here. So you can see that I'm under courses, and then scrolling down, these are the elements that Tyler went before. We've got this tile here. This tile here is it's called results. So before I even start digging into some of the reports, I can see that I can start to perform a learning needs analysis. We have these box and whisker graphs here. And so I can see just by hovering my cursor over this box and whisker graph, I can see that the maximum is 67%, the minimum is 9, the median is 42, and I can see that the majority of the students are sitting in quartiles 3, in the middle there. And I can see that the scores are sort of below 70%. So that will start to prompt me to think, what's happening with this? I can see with this post-session evaluation that the scores are quite high, and that's probably where I'd like them to be. And I can also see my pre-learning here. I can also see my top performing category here, which is standard 6 evaluation at 69, and my bottom performing category is diagnosis, is 12%. So I can see there's something probably going on with my students in terms of critical thinking and analysis. I'm just going to go into the course score reports now by clicking onto this hyperlink. It takes me into my course score reports page. Through this area here, I can see a spread of scores. Down here, I can see my students, and I can see their scores and their percentages. Now, to get into the reports, I've got this drop down here, and I can choose the report that I would like to see. The first report that I'm going to talk to is called Learner Score Statistics. I'm going to choose a student in here. I'm going to choose Dan Andrews as our student to have a look at. So this Learner Score Statistics enables me to do a learning needs analysis at the individual level. I can see along the top here, I've got my scenario, which is Vernon Russell. And down this side here, I can see my different question categories down here. So now I can see how my student is performing in these different question categories. Question categories are like Tyler said, they're often competency standards or elements of a curriculum. Over here in my question category, you'll notice that we can see some of these are in green. Okay, what this tells me, that light green color tells me that for that particular category, this student is 1 to 2 standard deviations above the mean. I can see over here, I've got some quick stats. I can see my class mean, my class standard deviation, the class high, and the class low. I can also see for this student that his overall score is 60.2, and it's in a dark green, which tells me he's 2 to 3 standard deviations above the mean. If I then go and have a look at a student who didn't perform particularly well, I can have a look here at Daniel LaRusso. You can see when this loads that you can see now that it's in this kind of lighter sort of salmon color. And I can see that he's 1 to 2 standard deviations below the mean in some of these elements. So this is a good guide and will prompt me where I need to structure Daniel's learning in order to improve some outcomes. The next report I want to talk to is the Learner Evaluation Score Statistics. The difference is with this report is that it's quite similar, except it outlines the evaluation as well as the scenario. So I can see the scenario along the top, and it's broken down here into the different evaluations that are attached to it. And again, I can see how the student is performing in the individual question categories. The next report I'm going to talk to is the question analysis. The question analysis enables us to analyze the question that was asked. I can choose the report that I want to read via this drop-down, and I can see my question here. Over here, I've got this colored area, which will draw my eye to anything that's going well or not so well. So I can see for the first question, when taking a patient history, select all that would increase the chances of stroke. Students have been doing very well with this, but I can see that there's some here with the red areas. So as the nurse caring for a patient with a suspected stroke, what should your first action be when the patient is having difficulty swallowing when administering prescribed medications? I can see there that the average is only 38.5. 5 got a full credit and 8 got no credit. So I can see that there's something going on with that. I'm now just going to move down to the live session evaluation, which was the one that you saw Tyler go through before. And I can see a similar pattern in here. The students are good at hand hygiene and introducing themselves and identifying the patient. But we can see here in terms of rationalizing what's happening with Vernon in terms of his TIA, we can see that they're not recognizing that he's losing his inability to swallow. Question 6, did the student perform a neurological assessment addressing the patient-specific requirements and medical orders, specifically about the ability to swallow? So I can see here that's 33%, 5 got a no credit with 11 with a partial credit. And again, in terms of escalating his care, we can see a similar pattern in there. Did the student escalate the patient's level of care, rationalizing the need to engage stakeholders, such as the medical officer, the charge nurse, and the speech therapist? So again, this is going to prompt me to analyze course outcomes. This type of report, the question analysis, is at the cohort level. The last report that I'm going to speak to is called the answer analysis. The answer analysis will analyze the answers that we got back from a particular evaluation. So we can see here in terms of the pre-evaluation, if we scroll down to where we know there's some problems, we can see here what the students are answering. So as the nurse caring for a patient with suspected stroke, what should your first action be when the patient is having difficulty swallowing? We can see here that they're not answering correctly. They should be saying, hold this dose and make the patient kneel by mouth. But we can see here quite a few are saying education. I'm now just going to choose the evaluation that was done during the session, which was the live evaluation. And similarly, we can see here how students were responding. So I'm going to scroll down into my known problem areas because that's where the answer analysis told me that the stuff is going on. And I can see here that many students weren't observed rationalizing the need to engage stakeholders during that simulation. Okay, that brings me to the end of the reports that are available. I just wanted to let you all know that SimCapture for Skills, which enables peer-to-peer scenarios and self-record, which was showcased at the LNN Summit, will also add additional capabilities to SimCapture. This will be by allowing students to practice in iterative formative practice of psychomotor skills training, and also self-record, which would be ideal for summative assessment of skill acquisition in psychomotor skill training. I'm now going to pass you back to Helen.
Fantastic. Thank you so much, Paul and Tyler. That was a great demonstration of SimCapture Enterprise. We actually had several questions come in to the Q&A box, so I'll just get started and start firing them off to you, Paul and Tyler. So the first question is, do all of the Laerdal mannequins communicate info into SimCapture?
Yes, they do. If you're running Leap software or SimPad, your mannequins off of SimPad, both of those do communicate with it, SimCapture.
Okay, excellent, thank you. Can we integrate any type of simulator, or do we have to use Laerdal simulators with SimCapture?
Yes, you're able to also add your other mannequin companies as well into SimCapture, and they can communicate. Realizing that what they do communicate might look a little bit different from the Laerdal mannequins that will communicate with SimCapture.
Okay, great. Thank you for that. This question's about assessments. Someone was asking, can they create their own assessments within SimCapture?
Absolutely. It's 100% customizable. Paul, do you want to elaborate on that?
Sure, absolutely. What we would generally do during your education encounter with a specialist is that we would identify areas of your curriculum that are important and how you're assessing, evaluating students. And it's essentially then getting a Word doc and then showing you how to import that and structure the evaluations with scoring and free text questions, etc., that meet your education needs for your students. So absolutely.
Excellent. Thank you. And then can you send notifications to participants in SimCapture?
Yes, you are able to send notifications, specifically around scheduled events. They get notified that they were added to courses, and they have an event scheduled.
Okay. Awesome. And then I think this one was answered in the chat box, but I'll bring it up here again. How long on the SimCapture, how long do SimCapture logs are they kept for?
They are kept for as long as you need them to be kept. There is a video deletion policy that can be implemented, so the actual video itself can be deleted at some point if you would like. And that can be automatically set up scenario to scenario with that, right? So you can put, 30 days, 180 days. I think 3 years is 1,095. Whatever that may look like for your school, it will be kept.
Okay. Paul, this might be a good question for you. Actually, it just came in. Are all the Sims focused on a student in a BSN program? Are there Sims for a student in a practical nursing program?
It can be for whatever you need. So whatever you need. So if it's more practical, we can make the evaluations and the annotations suit that, or we can make it more qualitative. So it's really whatever the learning requirement is.
Okay. Great. Okay. Another question is, can you link the recordings into an LMS for students to view, or do they have to log into SimCapture? It's a good question.
The students would log into SimCapture underneath their own profile, and then you will have to release or give them permission to view the recordings as well as the evaluations, and then they would be able to do that.
Okay.
You're also able to create a link, but that link doesn't have any student information or annotations associated with it as well, or any evaluations. It's just the recording that can be sent out.
Perfect. And then looking at calendars, can I integrate with other calendars, like within Outlook or Google?
Yes, you are able to associate the events in SimCapture to those calendars that you mentioned, the Outlook and the Google Calendar, yes.
Okay, great. And then how many video feeds can we have using Enterprise?
You have up to 6 inputs that are available, choosing 4 at each recording session. So you'll actually have 4 inputs available. For example, the one that we demoed today had 2 video inputs and 1 patient monitor. So that would be 3 inputs that we use today.
Okay. And then this one's actually about on-premise. So this person actually has on-premise and they're considering possibly moving to cloud, but they want to know if they can transfer their data from on-premise to cloud. And then how would they even get started with cloud? Like what would they need for that?
That's quite a big question, and I guess the way I would answer that is that we would have one of the SimCapture specialists in the team have a look exactly what they wanted to do, and how to bring it over. But yep. So it would need some analysis to see how and when, but essentially yes. Yep.
Okay. And then this one's actually about scenarios within Laerdal Cloud. So this person purchased scenarios in the Laerdal Cloud, and they want to know if they're the same or if there's a companion scenario for SimCapture.
Yeah, look, essentially what comes over is the SCX file, which is on Leap and SimPad. So you get that event-based data. But what we would do, what the education specialist would do, they would have a look at what's in your curriculum and then write evaluations that suit that scenario to integrate in. So then you get that nice balance of quantitative and qualitative data, and also those different ways of assessing and evaluating a student.
Okay. Thank you for that. And then someone actually asked about a SimCapture app. So I guess, is there an app, and how does that work if there is one?
Yes, there is a SimCapture app for ISO. You can record videos in there. You can record that video and then associate it with a scenario and a course. With that, you can also annotate within that app as well.
And just to clarify, those videos will be able to speak with like their larger SimCapture system, right?
Absolutely. Absolutely. For example, this is really good for those EMS type folks that might be doing something out of the lab, or if you have a nursing scenario that you want to do maybe in a bathroom or a home health type of situation, you can record that video, associate it with a scenario that you've already have in the SimCapture system with that.
Okay. And this actually, I think this question is good for Paul, because you mentioned SimCapture for Skills earlier. So one of the participants actually saw SimCapture for Skills on the website, and they're thinking about buying SimCapture Pro, but now they're considering SimCapture for Skills. And can you maybe just talk a little bit about the differences there, and talk more about SimCapture for Skills?
Sure. So SimCapture for Skills, you will get the reports that I outlined in there. So you'll be able to see that evaluations have been filled out if you're purely looking at a compliance thing to see whether they're doing it. But you can also go in and have a look at those reports, like the evaluation, the evaluations against the categories, the question analysis, the answer analysis, to do a learning needs analysis. And I guess the nice thing about that is that students would quite often practice in that formative manner, but we would have no way to actually know what they're doing, whether they're doing it down outside the lunchroom or whatever it is that they're doing. So we can now track that and use the reports as we go. So essentially you get the same reports to operate that functionality.
Okay. Thank you. And then this question actually is from someone who actually works in a healthcare facility, not in an academic setting. So due to the number of learners, it would be hard to monitor and assign accounts to each. Does the evaluation connect with other platforms like Forms Stack, SurveyMonkey, LMS systems, etc.?
Doesn't integrate in with those elements, but what you can do, you can pull out an evaluation via an Excel spreadsheet, but there is an SSO integration into an LMS. So essentially, the learner is essentially, well, their information is essentially coming across in terms of their login.
Okay. And someone's actually asking about Canadian content. With like lab values. I'm assuming that's a Laerdal Scenario Cloud related question. That might make sense to you, Tyler.
Lab values as in the information that's in the report. I'm not actually sure. I might need to get back to that person to understand that a little bit better.
I would say that content can be customized. So the annotations or evaluations, you can be completely customized within the SimCapture system, right? So if they are looking for a certain lab value or certain protocol that they want to implement within SimCapture, they're able to do that and customize that.
Okay, great. So another question is, how would I get started with cloud? If I just have like a blanket open brand new center that has nothing in there, how would I get started with implementing cloud? Do I need AV? How does that work?
I think in that would be like an assessment would need to be done by the SimCapture specialist to work out exactly what was needed, how many nodes, how many recording stations, that kind of thing. So I think that would require a bigger conversation as well. So I'd probably reach out to local client executive or customer representative.
Okay. And we can help you guys get in contact with your local representatives as well. So we have a couple of camera questions actually that have come in. So I don't know if you guys want to maybe just have like general conversation about cameras and all of that good stuff.
So I saw on the question here, I'm reading it as well. The vital signs, the actual patient monitor itself it's a screen capture. No matter what's on that device, for us, it was the patient monitor, but if it's the computer screen itself, it's being captured with that, and then that would be put within SimCapture.
Okay.
For the integration, so yes, you are able to do again other mannequins, as in Gamard, as well. Those mannequin companies will come over into SimCapture.
Okay. A question actually about roles and permissions. So someone asked if roles and permissions are the same.
As in from on-premise?
I'm guessing enterprise.
Yeah, so roles in Enterprise Cloud, there's 3 roles, but they're very flexible. So it's not like a normal learning management system. We can assign the different permissions depending on the role. So there's a systems admin, an admin, and a participant, but it's very, very flexible and very easy to set permissions and do what you need to do.
Okay. Excellent. Let me see if there are any more questions here that I may have missed. Tyler, I think you confirmed this, but can you confirm that the capture mannequin data is directly, you confirm that with the 4 inputs?
Absolutely. And just to elaborate on that just a little bit, it's the data input as in what the mannequin can recognize. Specifically from the Leap software, if they are checking pulses, it will come over into SimCapture. If you are changing vital signs, that will come over. Also, if you have a simulator that can capture BLS data, right? So CPR data, that will come over into SimCapture as well with the integration.
Okay, fantastic. Thank you. And actually, I think that's all the questions that I have. I don't see any that I've missed. If anyone has any last minute questions, feel free to just add them in the Q&A box and we will get those answered for you. Let's see. I was wondering if a student had to evaluate data given or the results in American values only.
American values as in the results. The results come through either, and you can see the results either as a percentage or a standard deviation from the mean. So it would depend on that. They're your 2 choices.
Okay. Awesome. Well, those are the questions. I don't see any other ones coming in, and hopefully I didn't miss any. But Do you guys have any last minute things that you want to add, Paul and Tyler?
No, I'm pretty good. Look, it's a really great way to assess and evaluate students, and the robust, it's very robust in data. Look, I will say that the SimCapture for Skills is a great way to move into this kind of higher end usage of SimCapture. It's much easier to set up and perfect for formative assessment. But no, it's from what I can see, and the customers I work with, they really like the reporting and the evaluations in the system.
Exactly kind of what Paul was saying. The customers that I have interacted with, they're very excited about the new type of data, right? And they normally have collected some type of data in the past. It might have been on some type of paper form, but nothing has really been done with that data that they've been collecting. Here with SimCapture, now you can make that data that's been collected useful to improve and advance your program. And going back, right? So the SimCapture is also nice for EMS services, LPN programs. We have MA programs that utilize it as well, EMT programs. We have all sorts of different types of customers that are utilizing it, and then also evaluating the students at each level as well.
Mm-hmm. Okay, well, Paul and Tyler, thank you guys so much for taking time to go over this demonstration. I found it to be very valuable, and I hope the audience did as well. So if anyone's interested in learning more about SimCapture Enterprise, please visit laerdal.com/SimCapture or reach out to your local rep. We are here to assist you guys and help you with anything you need. So thank you all so much for joining, and I hope you guys have a great day.